Dr. Sarah is coming today from Pakistan, and she has built what I believe is the largest telehealth business in Pakistan with over 7,500 providers on the platform. Is that correct that you're the largest telehealth platform in the country?
I'll say one of the largest. Now, the first theme that I'll touch on is the doctor patient mismatch that we have. So, we have 240,000 doctors. That means there should be one doctor for 1,000 patients. But majority of the medical workforce is made up of women doctors. And because of social cultural barriers, a lot of women doctors in Pakistan don't practice. They become what we call doctor brides, which is one of the reasons why we created Sehat Kahani. But more from a theme perspective, when a lot of doctors, female doctors, don't work after marriage, it creates a gap in the health ecosystem. Now, Pakistan is also a country from which a lot of young people move out for better work opportunities. To one of those countries is the USA. So every year, 25,000 doctors move out and do their residencies abroad and they do their medical programs. So in actuality, we have less than half a doctor for 1,000 patients. I think that's a great question. I think Pakistan was one of the very few countries that in the 1970s created a model which was called the Lady Healthcare Worker Model, the LHW model. And around 5 to 6,000 of lady healthcare workers were created at that time, and their primary role was to address this very shortage of doctors in low-income areas with respect to health education, counseling, family planning, and birthing also. And later on, there were a lot of cadres of healthcare workers created. So we have lady health visitors, we have midwives, we have community midwives. Because when we think about primary healthcare issues, the bigger primary healthcare issues that have always daunted Pakistan until recently were maternal child healthcare issues. Because we had high maternal mortality rate, high infant mortality rate, one of the worst neonatal mortality rates. And later on, she said, this is not working, they need to see you. So she bought a webcam and she stuck it with tape on her laptop, and we started doing video calls. And in that, just doing that, I realized, okay, I'm in Lahore, I'm 1,000 miles away from Karachi, and I'm doing teleconsultations and seeing patients, and this is working. So why can't we create a network of women doctors across the country that can just provide primary care in communities using telemedicine, and that would just solve a lot of issues of primary healthcare. And I had this aha moment in my life. So when we started Sehat Kahani, the initial model was that we will convert local clinics and communities into telemedicine centers by training the nurse, putting a telemedicine system there and connecting them to online doctors. So that when patient walked in, a nurse could take initial history and examination, but then connect the patient to the online doctor.
And what year was this when you first started?
This was around 2016,
Okay.
2006, yeah. And officially the company started in 2017. So we started making that chain of clinics. The company started growing. From the first day, the clinics were paid. So we started making revenue, and we made the business model in a way that within 12 to 18 months, the clinic would break even on its OPEX, provided someone was giving us the CAPEX. And the company started attracting, it attracted some funding, some soft funding. So by 2019, we had the app. And a very interesting feature that we added in the app, because in the clinic, I had this learning that when patient walked in, and without no waiting time, without no travel, when they were instantly connected to the doctor, that was the aha moment that I saw in the clinics. So I thought, when I will make an app, I will connect the patient to a doctor within 60 seconds. So that there's no wait time and there's no appointment booking. It becomes very easy, like food delivery or ride hailing. So we made that up. We made that and we started talking about the app everywhere. But when the app actually launched, it didn't work. So we had 50, 60 doctors on the app, maybe 10, 15 patients showing up every day, because till that time also in 2019, in mass cultures, health was very physical in Pakistan. And on 20th March, the country went to the lockdown. And on 15th March, I got connected to the federal health government, and the person who was heading digital initiative said that we need an app as the country goes in the lockdown. And I've heard you say that you can connect a patient to a doctor within 60 seconds. So we need the app. And within a week, that the app was given by the federal government to everyone, it just exploded. We started getting a lot of consultations on the application, and that is when we realized that there's a market in Pakistan who desperately need services for their employees and families, which is the corporate market. And they were looking for any opportunity to provide a doctor to their employees as they sat at home in lockdown. And we started pitching. So everyone in my company, there were around 40 people in my company, everyone became a salesperson. And we started pitching to every corporate that we knew, left, right, and center. And over time, 5, 6 corporates signed up. Their CEOs were on boards of other corporates. They pitched us. And from 5, 6 corporates, we went to 50, 60 corporates in 3 months. And from 50, 60 corporates, we have now become the largest corporate telemedicine provider in the country. So, all in all, if I tell you, Sehat Kahani has a clinical model in low income areas where we provide telemedicine, and we also have closet pharmacy. So, we also house pharmacy in our clinics now, and we have 63 of these clinics across Pakistan, the largest telemedicine clinic chain. For our application, we do telemedicine, claim management, pharmacy, and we also do home health care, which is sending a nurse or an attendant to a patient's home, doing 24/7 remote monitoring of the patient and getting them connected to online doctors as need be. We also provide health education services and mental health services on the application. So, all in all, there are around 7 services that we provide through the Sehat Kahani platform today for different kinds of customers, different socioeconomic groups, different genders, as need be.
So you're covering a lot of grounds in home health, in clinic, and corporate markets.
So we right now we so over the years we've made a network of doctors, and the network of doctors is around 7,600 doctors now. And these are doctors that we have trained over time, or they have taken our trainings. So we have an online learning management system where we train doctors to come back to work or take tutorials or soft courses to be a part of our network, so that as need be, as the recruitment cycle starts, we can just pick doctors from this network and we can start recruiting them. Overall, we have around 1,000 doctors in the system today that come on the app and in the clinics on a daily basis and provide consultations. We did around 900,000 consultations in 2024, and this year we've done 1.2 million consultations. Yeah, we've impacted around 4.3 million consultations on the application. On the apps totally, we have around 1.6 million users, and on the corporate app, they have families registered as sub users as well. So, in on the corporate application, we actually service around 7 million people with 1.3 registered users. Now, when the entire claim ratio gets used, when you're going to the insurance company the next year to pay a premium, the insurance company will tell you, hey, listen, your claims limit went really overboard, so I'll increase your premium this year. And that's where the corporate loses. How the insurance company has lost is last year they have borne larger claims ratio than paying that premium. So everyone is at loss when higher hospitalization gets used. So that's why when companies like Sehat Kahani come into the picture, if a patient comes to us, we'll tell them, listen, you don't have a problem that needs to go to a tertiary care hospital. We'll see you here. If need be, then you can go. So a lot of those unnecessary tertiary care visits get reduced. The insurance company saves on their claims cost, and the corporate saves on their premium next year. And one of our bank partners actually did a study 2 years ago in which they saw that in 2 years that they have used Sehat Kahani service, the claims ratio went down 27%. And this is where 16,000 employees and their families were using Sehat Kahani services. So in the clinic, there are two kinds of clinic. Either they are done in partnership with the government or the patient pays itself. So right now, the majority is where the patient paying itself. But as a scale strategy, we are moving more and more towards government or institutional partners, because as we reach to more hard to reach areas, the payability becomes a challenge. So while patient paying is good for sustainability, it is also a limiting factor because it inhibits us going to more rural areas where maybe paying 100 rupees might be a challenge for a patient also. And there are lots of localities like these. So it's a scale strategy. On the corporate application, yes, the insurance company or the larger corporate is paying, but we also have a consumer app where the patient is paying themselves. So we started working in the GCC market last year, and we already are active in UAE. And the next market that we're looking is Saudi Arabia. Again, because there are a lot of cultural similarities, similar healthcare burdens, a lot of expats, Pakistani expat doctors available. Although, we will hire local doctors as well, but if we had a big community of doctors already in our network to start with. And when we saw per patient profitability, it was growing 4x as compared to Pakistan. So our regional expansion plan is for the GCC market for the first 2 years for the corporate application. So this is where we'll take our corporate application. But we also have plans of launching our clinical model in other geographies, which might have doctor-patient mismatch or primary healthcare issues. And this year we are opening 2 clinics in Kenya with a fund that we have recently done. So this year we're working a lot on our AI solutions of, how can we create doctor assistants? How can we make our Emily more automated? How can we do our e-prescriptions more automated? How can we, create more AI-based inventory management system for rapid pharmacy delivery. So a lot of work that we're doing with technology also to make sure that we have a good service to provide, not just in Pakistan, but regionally as well.
We started with a question about the overall Pakistani healthcare system, the priorities and the needs within the country.
Thank you for joining us on Analyzing Healthcare. Stay informed and stay inspired. Don't forget to subscribe and visit scale-community.com to become a Scale Community member. Until next time, keep exploring the ideas that shape our healthcare systems.